Good morning everyone. Welcome back to channel Medical with Sanju. I hope you all are fine and your study is also going well. I am come back with NNC Set-22. So the first question is, you already know the instructions of the exam. So we start from question number 1. Which of the following is the largest cranial nerve? Option A, vagus nerve. Option B, optic nerve. Option C, trigeminal nerve. And option D, trochlear nerve. You know very well the largest cranial nerve is a trigeminal nerve. Option C is right answer. Sometimes ask question like that. What is the longest cranial nerve? Longest cranial nerve is a vagus. Shortest and smallest cranial nerve is trochlear. Largest and thickest is a trigeminal and complex cranial nerve is trigeminal. Question number 2. A state due to loss of excessive ions of carbon dioxide from the body is known as option A, respiratory acidosis, option B, metabolic acidosis, option C, respiratory alkalosis, and option D, metabolic alkalosis. Right answer is option C, respiratory alkalosis. Usually, the body is able to balance the iron that control acidity. If there is a loss of excessive ions of the dioxide, in this case, this is respiratory alkalosis. Question number 3. Which part of mammalian alimentary canal does not secrete any enzyme? Option A, mouth. Option B, esophagus. Option C, stomach. And option D, duodenum. Esophagus does not secrete any enzyme. Option B is right answer. Question number 4. The arterial which takes blood away from the glomerular capsule is option A, afferent arterial, option B, efferent arterial, option C, loop of Henle, option D, distal convoluted tubule. The arterial which takes blood away from the glomerular capsule is efferent arterial. Option B is right answer. You can see in this picture. And when the blood enters the glomerular through a small artery, this is called afferent arterioles. Entry means afferent and away from the glomerular capsule is afferent. Question number 5. What is the pressure of a vitreous humor in eye? Option A, 5 to 10 mm of Hg. Option B, 15 to 20 mm of Hg. Option C, 10 to 15 mm of Hg. And option C, 20 to 25 mm of Hg. The vitreous humor pressure is 10 to 21. The right answer option B. यहाँ 15 to 20 दिएको छ तर एक्ज्याक्ट 10 to 21 हुन्छ. Question number 6. Which type of drug is a mebendazole? Option A, antifungal. Option B, antihelmintic. Option C, antibactericidal. And option D, antiviral. Right answer is option B. Antihelmintic is a drug of mebendazole. Question number 7. The most important electrolyte of intracellular fluid is option A, sodium, option B, calcium, option C, potassium, and option D, chloride. The most important electrolyte of intracellular fluid is potassium. Option C is right answer. Question number 8. Nepal Nursing Council was established in option A, 1953 BS, option B, 2053 BS, option C, 1954 BS, and option D, 2054 BS. The Nepal Nursing Council was established in 1996, that is 2053 BS. Option B is right answer. Question number 9. A nurse administers an intravenous solution of 0.4% sodium chloride with respect to human blood cells. To which category of a fluid does this solution belongs? Option A, isotonic, option B, hypotonic, option C, isometric, and option D, hypertonic. आइसोटोनिक 0.9% हुन्छ। यदि त्योभन्दा कम छ भने हाइपोटोनिक र त्योभन्दा बढी छ भने हाइपरटोनिक। दिस इज हाइपोटोनिक। ऑप्शन बी इज राइट आन्सर। Question number 10. In water cell drainage, bottle should be option A above the chest level of patient, option B below the chest level of patient, option C at the level of chest, and option D at any convenient level. In water cell drainage, bottle should be placed below the chest level of patient. Option B is right answer. Question number 11. Approximate height of bottle from the bed of the client should be option A 30 cm, option B 45 cm, option C 35 cm, and option D 55 cm. cm. Option B is right answer. Question number 12. Nursing care for a patient with an indwelling catheter includes which of the following? Option A. Irrigations of the catheter with 30 ml of a normal saline solution every 4 hours. Option B. Encourage a generous fluid intake if permitted. Option C. Changing catheter every fortnight. Option D. Informing the patient diet, burning and irrigation of the meters are normal, subsiding within few days. The appropriate answer is option B. Encourage a generous fluid intake if permitted. Question number 13. A patient is scheduled for NG feeding. In which position should the nurse place the patient? Option A. Low floor position. Option B. Supine position. Option C. Tendelberg position. And option D. Sideline position. For NG feeding, the patient should be placed in low floor position. Option A is right answer. Question number 14. Sterile urine specimen is collected from option A. From clean bedpan or urine. Option B. The first small amount of urine voided. Option C. Urine voided at a midstream. And option D. All of the above. Sterile urine specimen should be collected from urine avoided at midstream. Option C is right answer. Question number 15. A patient has an abnormal, unexpected response to a drug. This is defined as option A. Drug intolerance. Option B. Anaphylactic reaction. Option C. A cumulative effect. Option D. Idiosyncratic effect. Right answer is option D. Idiosyncratic effect. र यसलाई रिभर्स ड्रग रिएक्सन पनि भन्छ ADR. Question number 16. A patient is having dyspnea. To facilitate respiration, the nurse would option A. Remove pillow from under the head. Option B. Elevate the head of the body. Option C. Elevate the foot of the body. And option D. Check the blood pressure. Should always elevate the head of the body in the case of dyspnea. Option B is right answer. Question number 17. A patient is to have a gastric gavage. In which position should the nurse place the client when the gavage tube is being inserted? Option A. Supine position. Option B. Mid-floor position. Option C. High floor position. And option D. Tendelberg position. For tube gavage, always maintain high floor position. Option C is right answer, sir. And in the case of feedings, should maintain mid floor position or a low floor position. Question number 18. Vitamin K 10 mg given IM and is ordered vitamin K is available as 5 mg per ml. How much would the nurse administer? Option A 1 ml, option B 4 ml, option C 3 ml, and option D 2 ml. 2 ml should be administered. Option D is right answer. Question number 19. The differences between the apical and the radial pulse is called. Option A pulse defect, option B pulse amplitude, option C ventricular rhythms, option D heart arrhythmia. The differences between the apical and the radial pulse is pulse defect. Option A is right answer. Question number 20. When the elevated temperature fluctuates widely but does not reach normal level, between fluctuation is called. Option A constant fever, option B relapsing fever, option C intermittent fever, and option D remittent fever. This is remittent fever. Option D is right answer. Sometimes ask a question about constant fever, relapsing fever, and intermittent fever. So, first of all, intermittent fever means the fever has a fluctuating baseline between normal temperature and the fever levels over the course of the day. Remittent fever means this type of fever may come and go, and the fluctuation of the temperature, but through it falls. It never fall all the back to the normal. Hectic fever is not asked. This is not compulsory. Continuous fever means it is also known as the sustained fever. This is a prolonged fever with little or no change in a temperature over the course of a day. Relapsing fever means this is a type of intermittent fever that is picking up again after a day or week of a normal temperature. This type of fever is common with animal bite and diseases like malaria. Question number 21. The movement of the solvent water from an area of lesser concentrations to an area of a greater solute concentration until equilibrium is established is known as option A osmosis, option B diffusion, option C active transport, and option D filtration. The right answer is option A osmosis. Question number 22. A nurse must get consent for procedures for the following client. Which client is legally allowed to give informed consent? Option A, an unconscious client, a sedated client. Option C, a client who cannot read. Option D, a 14 years old with a broken arm. A client who cannot read is legally allowed to give informed consent. Option C is right answer. Question number 23. Elimination means option A termination of a transmission, option B interruptions of transmission, option C both A and B, and option D effects to infection. The right answer is option C both A and B. Question number 24. Which of the following is the contraindications to study magnetic resonance image MRI? Option A, the patient is allergic to shellfish. Option B, the patient has a pacemaker. Option C, the patient suffers from a claustrophobia. And option D, the patient takes antipsychotic medicines. The contraindications of MRI are cardiac pacemaker, implanted cardiac defibrillator, internal pacing wire, clips such as cerebral carotid or aortic aneurysm, cochlear implants, any implant held in by magnet like that. These all are the in the pregnancy. These are the contraindications of MRI. So the right answer is option B. Question number 25. During CPR, if your breathing is appropriate, which finding will you act? Option A, pupils are dilated. Option B, chest rise when air is forced in. Option C, heart sound is heard. Option D, pupils are equal and normal in both eyes. Chest rise when air is forced in. Option B is right answer. Question number 26. Which is the best positions for a woman in a labor when prolapsed upper cord present? Option A, Tendelbar's position. Option B, floor position. Option C, lithotomy position. And option D, prone position. Option A is right answer, Tendelbar's position. Question number 27. Which is the unfavorable factor affecting wound healing? Option A, young age. Option B, intake of protein calcium. Option C, hemorrhage. Option D, abundant blood supply to the injured part. Unfavorable factor is hemorrhage. Option C is right answer. Question number 28. Which one of the following method is appropriate for maintaining airway in a case of suspected cervical injury? Option A, head tilt chin lift maneuver. Option B, head down and chin down. Option C, extend the neck. Option D, jaw thrust maneuver. Jaw thrust maneuver. Option D is right answer. Question number 29. The best position the client in a shock is. Option A, prone position. Option B, supine position. Option C, one the back with the leg elevated. Option D, one his side with his neck extended. In the case of shock, maintain one the back with the leg elevated. Option C is right answer. Question number 30. QRS wave in ECG indicates. Option A, arterial depolarization. Option B, arterial depolarization. Option C, ventricular repolarization. And option D, ventricular depolarization. P wave indicate arterial depolarization. QRS complex indicate ventricular depolarization. T wave indicate ventricular repolarization. U wave indicate unknown. So the right answer is option D, ventricular depolarization. Option D हुन्छ यहाँ. Question number 31. The twice categories of victims in a mass casualties are. Option A, red, blue, green, black. Option B, green, yellow, black, red. Option C, green, yellow, red and black. Option D, red, green, black, blue. The right answer is option C. This is the sequence: green, red, yellow, red. Question number 32. To prevent a pulmonary embolism in a patient on a bed rest, the nurse should. Option A, encourage deep breathing and coughing exercise. Option B, use knee support when the patient is in bed. Option C, limit the patient intake of fluid. Option D, teach the patient to move the leg when in bed. To prevent pulmonary embolism, the patient on the bed, the nurse should encourage diet to move the leg when in bed. Option D is right answer. Question number 33. A patient is receiving 1000 ml of IV fluid per 24 hours using an IV set with a drop rate of 15 drops per ml. Nurse should plans to regulate the IV is. Option A, 10 drops per minute. Option B, 15 drops. Option C, 20 drops. And option D, 30 drops per minute. यसको फर्मुला यो हुन्छ भोल्युम ml इन्टु ड्रप फ्याक्टर बाई टाइम इन मिनट्स. अब यो फर्मुलामा यो भ्यालुहरू पुट गरेर कति यसको आन्सर आउँछ यहाँहरु कमेन्टमा चाहिँ आन्सर दिनु होला. Question number 34. One of the major process to evaluate the nursing care of the patient is. Option A, patient chart. Option B, doctor's instruction. Option C, nursing progress note. And option D, doctor's progress note. Right answer is option A, patient chart. Question number 35. While administering a blood transfusion, when would the nurse assess the patient for a blood transfusion reaction? Option A, 15 minutes after the infusion is started. Option B, after the host is all informed. Option C, every hour. And option D, every 15 minutes. every 15 minutes. Option D is right answer. Question number 36. NLEN is conducted by option A NNC, option B ICN, option C NAN, option D ICN, INC, option D INC. जो nursing license exam NNC Lilinja, option A is right answer NNC. Question number 37. Immediately after a snake bite, the most important part of treatment is option A. Reassuring the victim. Option B. Tourniquet is applied. Option C. Incision and suction. Option D. Treated with anti-snake venom. Option first of all, reassuring the victim. Option is right answer. Question number 38. Question number 38. Vomiting is contraindicated in which type of poisoning? Option A. OP poisoning. Option B. Mushroom poison. Option C. Kerosene. And option D. Dhatura poisoning. Vomiting should be avoided in a case of kerosene poisoning. Option C is right answer. Question number 39. To obtain a specimen for sputum culture and sensitivity, which of the following instruction is the best? Option A. Upon walking up, cough deeply and expectorate into container. Option B. Cough after pursed lip breathing. Option C. Save sputum for 2 days in a covered container. Option D. After respiratory treatment, expectorate into container. The right answer is option A. Question number 40. A client has a temperature 104 degree Fahrenheit. This temperature is equal to option A 38 degrees Celsius, option B 40 degrees Celsius, option D 41 degrees Celsius, and option D 42 degrees Celsius. Change from Fahrenheit to Celsius. Use the formula Fahrenheit temperature of Fahrenheit is equal to 9 by 5 into Celsius temperature plus 32, and from Celsius to Fahrenheit 9 by 5 into Fahrenheit temperature minus 32. Answer B. Question number 41. When suctioning an unconscious client, which nursing intervention should the nurse prioritize in maintaining cerebral perfusion? Option A. Administer diuretics. Option B. Administer analgesic. Option C. Provide hygiene. And option D. Hyperoxygenate before. Hyperoxygenate before and after suction. Option D is right answer. Question number 42. Scald is a burn caused by option A. Dry heat, option B. Radiation, option C. Most heat, and option D. Friction. Caused by most heat. Option C is right answer. Question number 43. Which of the following is the best indicator would the patient fluid balance status? Option A. Intake and output. Option B. Skin turgor. Option C. Complete blood count. And option D. Daily weight. The best indicator to maintain the balance status is a daily weight. Option D is right answer. Question number 44. The nurse determines that a client is having a transfusion reaction. After the nurse stops the transfusion, which action should immediately be taken next? Option A. Remove IV line. Option B. Run normal salines at a deep vein of inlet. Option C. Run 5% dextrose. And option D. Obtain a cultures of the tip of the catheter, a device removed from the client. First of all, stop transfusion and then start normal saline. Option B is right answer. Question number 45. The nurse is performing an abdominal assessment. The nurse perform which assessment at first? Option A. Auscultation. Option B. Inspection. Option C. Palpation. And option D. Percussion. The first assessment point is a inspection. Option B is right answer. Question number 46. If the client is receiving mannitol, which information is important to receive? Option A, urinary output. Option B, pulse rate. Option C, respiratory rate. And option D, skin condition. Urinary output. Option A is right answer. Question number 47. Time required for the used gloves and instrument in 0.5% chlorine solution is option A 10 minutes, option B 20 minutes, option C 30 minutes, and option D 40 minutes. 10 minutes. Option A is right answer. Question number 48. During administrations of enema, a client complains of intestinal cramps. The nurse should option A give at a slow rate, option B discontinue the procedure, option C stop until cramps are gone, option D lower the height of the container. Stop until cramps are gone. Option C is right answer. Question number 49. Which of the following is the backbone in disease prevention? Option A epidemiology, option B demography, option C vital statistics, and option D health statistics. Epidemiology is the backbone in disease prevention. Option A is right answer. Question number 50. Father of public health is option A Sushruta, option B check, option C area, option D cholera. Father of public health is cholera. Option D is right answer. Question number 51. The ultimate digestion of protein occurs in the form of option A amino acids, option B glucose, option C fatty acids. The ultimate digestion of protein occurs in the form of amino acids. Option A is right answer. Question number 52. Whooping cough is caused by option A Bordetella pertussis, option B Brucella mitis, option C Brucella abortus, and option D Staphylococcus aureus. Whooping cough is caused by Bordetella pertussis. Option A is right answer. Question number 53. Viral test is a diagnostic test of option A cholera, option D typhoid fever, option C hepatitis B, and option D poliomyelitis. Viral test is diagnostic test of typhoid fever. Option B is right answer. Question number 54. The cases occurs irregulars haphazardly from time and generally infrequently is option A epidemic, option B sporadic, option C pandemic, and option D endemic. Right answer is option B sporadic. Sporadic means occasional occurrence. Endemic means regular cases occurring in an area. Epidemics means usually higher of a case in an area, and pandemic means a global epidemic. Question number 55. Which of the following dimension is not included in WHO definition of health? Option A physical well-being, option B occupational well-being, option C mental well-being, and option D social well-being. Occupational well-being is not included in WHO definition of health. Option B is right answer. Question number 56. Which is not the element of communication? Option A communicator, option B audience, option C message, and option D culture. Culture is not the element of communication. Option D is right answer. Question number 57. When was the Alma Ata conference held? Option A 1972, option B 1988, option C 1978, and option D 1990. The right answer is option C 1978. Question number 58. Cholera is a disease of option A eyelid, option B cornea, option C conjunctiva, and option D lacrimal gland. Cholera is a disease of eyelid. Option is right answer. You can see the stage in the first infection caused by chlamydia. Bacterium cause inflammations and it thickens the upper eyelid. In two, carrying of the eyelid pulls the eyelashes into the eye, and in stage 3, the eyelashes scratch the cornea and continue to infect the damage the eye, which can lead to blindness also. Question number 59. DOTS stand for option A directly absorbed treatment short course, option B direct absorbed treatment short course, option C direct absorbed treatment system, and option D directly absorbed treatment system. Right answer is option A directly absorbed treatment short course. Question number 60. The vector of malaria is option A Plasmodium vivax, option B Plasmodium falciparum, option C Plasmodium falciparum, and option D female Anopheles mosquito. The vector of malaria is female Anopheles mosquito. Option D is right answer. Question number 61. Kala jar is transmitted by option A mosquito, option B sandfly, option C housefly, and option B bee. Kala jar is transmitted by sandfly. Option B is right answer. Question number 62. Oral contraceptive act by option A preventing ovulation, option B making endometriums non-reactive to embryo, option C making inactive to sperm, and option D inhibiting sperm penetration to the ovum. Oral contraceptive act by preventing ovulation. Option A is right answer. Question number 63. Complex spot is the clinical feature of option A measles, option B tuberculosis, option C chickenpox, and option D leprosy. The right answer is option A measles. Question number 64. Which of the following is the principles of primary health care? Option A health education, option B dental health, option C mental health, and option D community participation. Community participation is the principle of primary health care. Option D is right answer. Question number 65. Which type of vaccination is given against measles? Option A live attenuated vaccine, option B killed vaccine, option C toxoid vaccine, and option D inactive vaccine. Live attenuated vaccine. Option A is right answer. Question number 66. The comprehensive assessment of the health status of the entire community is called option A community diagnosis, option B home visit, option C micro teaching, and option D health education. Right answer is option A community diagnosis. Question number 67. The most commonly accepted family planning method in Nepal is option A oral pills, option B condom, option C Depo-Provera, and option D nerve plant. The most commonly accepted family planning method in Nepal is Depo-Provera. Option C is right answer. Question number 68. Incubation period of influenza is option A 6 to 18 hours, option B 12 to 36 hours, option C 18 to 17 hours, and option D 1 week. The right answer is option C. Question number 69. Which of the following vitamin is stored in liver? Option A vitamin A, option B vitamin B, option C vitamin C, and option D vitamin D. The right answer is option A vitamin A. Question number 70. 1 gram of carbohydrate provides option A 4 kilocalorie, option B 9 kilocalorie, option C 7 kilocalorie, and option D 10 kilocalorie. 1 gram of carbohydrate provide 4 kilocalorie. Option A is right answer. 1 gram of protein provide 4 kilocalorie. 1 gram of fat provide 9 kilocalorie. Question number 71. Which of the following drug is not used first line drug in the treatment of TB? Option A rifampicillin, option B ethambutol, option C isoniazid, and option D calamicin. Calamicin is a second line drug in the treatment of tuberculosis. Option D is right answer. Question number 72. One is said to be neonate from birth to. Option A 4 weeks of age. Option B 4 months. Option C 4 days of age. And option D 4 years of age. Neonate from birth to 4 weeks of age. Option A is right answer. Question number 73. Except breast milk, no other food required to be given up to. Option A 4 months. Option B 6 months. Option C 7 months. And option D 9 months. 6 months. Option B is right answer. Question number 74. A body weight triple, its birth weight the end up. Option A 6 months. Option B 1 year. Option B 9 months. And option D 2 years. Triple in 1 year. Option B is right answer. Question number 75. Interior fontanelle usually close at. Option A 2 to 3 months. Option B 18 to 24 months. Option C 10 to 12 months. And option D 50 to 36 months. Interior fontanelles usually close at 18 to 24 months. Option B is right answer. 75 वटा क्वेशन्स सेट 22a मा र रिमेनिङ क्वेशन सेट 22b मा हुनेछ किनभने भिडियो लामो हुन जान्छ सो thank you so much everyone. Please if this video is help you then please subscribe, like and share the channel. Thank you so much.